Hi, this is Dr. Christi Pramudji, and today I want to help you learn about treatments for vaginal atrophy. This is when your vagina is too dry, it's painful, it's irritated, especially during intercourse, and you also have some occasionally some bladder problems related to that, with overactive bladder and urine incontinence because the bladder is not healthy because of the lack of estrogen to the area. The other thing that happens is recurrent bladder infections because of the lack of healthy bacteria in the vagina. So we're going to talk about 3 treatments that are very effective for vaginal atrophy, and then some natural remedies that you can do. I want to remind you to subscribe to my channel. I do release new content every week, and I'm here to educate you and inform you and keep you up to date on the latest and greatest for your pelvic health. All right, so let's dive right in. So the first treatment for vaginal atrophy is estrogen replacement in the vagina. There are creams, there are pills that you can put in the vagina, and there is a ring that you can put in the vagina. So they all have their pros and cons. We usually use the cream simply because we can really rub it into the area, and we can really target around the opening of the vagina, which is where a lot of the symptoms occur. The estrogens are very safe, even in someone that has a family history of breast cancer, even someone that has gone through breast cancer themselves. The oncologist will let them have it because very little of it gets into the bloodstream. It pretty much stays locally in the pelvic area and helps restore the vaginal walls, and it really improves the quality of life. The vaginal walls become much softer and more comfortable. They become much more like a youthful vaginal wall. So that's the first treatment, is estrogen replacement into the vagina directly. Okay, number 2 is the laser. The CO2 laser is the most popular and common laser that is used. It's called MonaLisa Touch, and it is a carbon dioxide CO2 laser. CO2 lasers have been used on the face for many years to resurface the face, to get rid of fine lines and wrinkles, and kind of bring back that glow and that plumpness to the face. That's a painful procedure. So the women in Italy that first volunteered for this were very brave, but fortunately they found out that the laser in the vagina is not painful. It's amazing. So the probe is inserted into the vagina, and the laser is deployed all around the vaginal walls. It takes about 5 minutes. And what it does is it gets rid of the bad tissue and builds up new, wonderful tissue. And they actually have studies that show the vaginal wall thickening up from a really thin little fragile layer back up to a nice, plump, healthy layer that's going to have more collagen, elastin, blood flow, and with blood flow you get lubrication. You also get a buildup of good bacteria, so you have less infections. In addition, the bladder is also improved because the bladder gets healthier as well with better blood flow. So that's number 2. Number 3 is radiofrequency therapy, such as Thermiva. That's what I have in my office. It is a fantastic therapy. It's very similar to the laser because the idea is that you're heating up the vaginal wall. You're taking these dormant cells that have just kind of gotten quiet and tired, and you're rejuvenating them so that they're going to wake up and make new blood flow, new collagen, new elastin, and get everything back to where it used to be. The Thermiva is a longer procedure. It's about 20 to 30 minutes as opposed to 5 for the MonaLisa. Both of these treatments, the laser and the Thermiva, are both going to be a series of 3 treatments optimally. Some people will notice that they're great after 1 or 2 treatments. Some people do need a few more treatments. But the average is 3. You're in and out. It's an office-based procedure. There's virtually no pain with both of these procedures, and they both work beautifully. Okay, so and then the final thing I wanted to talk to you about was natural things that you can do right now to help you be more comfortable. So there is vaginal moisturizers, such as KY brand, and these are not lubricants necessarily for intercourse, but a little moisturizer that you can put in every day, every other day, to keep things lubricated internally. Now, when you have intercourse, you want to get a water-based or silicone-based, preferably silicone-based lubricant. They're going to work so much better for you. They're going to be much much more slippery, and they don't dry out as quickly. So Astroglide is a popular brand. Eros can be found on Amazon as well. If you want to be very natural, then coconut oil and olive oil can be used as lubricants, and those will work beautifully for you. All right, well, I hope that helped you. I hope if you learned anything today that you'll give me a thumbs up. I hope you'll subscribe to my channel. I do try to put out new content at least once a week, and click on the little bell so you'll know as soon as you get a new video. And then please comment, give me any questions. Go to my website. We have an info line where you can ask private questions. And I hope you have a great day. I also, below this video, you can see a link for a free guide to 5 hacks for better sex after menopause. So I hope that'll give you something that'll help you out a lot. All right, well, you take care and God bless you. Have a wonderful day and a wonderful week.